During the height of the COVID-19 pandemic, the team at Boston Medical Center created the FeesBox, a novel barrier to contain particles during aerosol-generating procedures. We were inspired by the intubation box, a transparent plastic cube designed by Dr. Rafael Ortega's group at Boston Medical Center to cover a potentially infectious patient's head during urgent intubations. Our aim was to create an upright version that would be adaptable for other endoscopy exams, such as FEES. Our adaptations came from an innovative design by Dr. Calvin Brown III, who created a PVC cube that was used in the Brigham and Women's emergency room. His design was featured on the Boston News during the height of the pandemic. He provided us with the specs to adapt the cube for our purposes for FEES exams on potentially infectious patients. The FeesBox is a 26 by 23 by 25 inch cube made of 3/4 inch PVC piping. The joints are 90-degree elbow sockets, and there are various attachments for different beds or chair sizes. We tested the FeesBox in the simulation center, trialing arm placement, glove attachments, and patient positioning. We tested clinical scenarios to account for various bed and chair types, patient types, various FEES tasks, and more scenarios, and more scenarios, and even more scenarios. Our testing also included data collection to scientifically study the efficacy of the box in reducing the number of particles produced during FEES tasks, such as coughing, sneezing, and the use of aerosolizing spray. We then presented our idea before the team of infectious disease specialists who approved its use at Boston Medical Center. As part of the Boston Medical Center Personal Protective Equipment Protocol, we don CDC-recommended PPE in addition to using the FeesBox on confirmed or suspected COVID-19 patients. Here we are using the FeesBox clinically on an inpatient.
Oh, like down here?
Yeah.
This is weird because I'm like a lefty and this is a righty stance, I think.
Yeah. Yeah. And that's how you would do scoping?
Mm-hmm.
Can you move your hands around a lot? Nice. Okay. Okay, we're good.
Please feel free to reach out if you have any questions about the FeesBox.